Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.
Hello and welcome to Aging Matters. This is a program that is provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. We've got a jammed-packed show this evening, so without further ado, I'd like to introduce my guest with me, John Vogel.
Hello, Ann. Good to see you again.
Thank you. He is our trained Medicare specialist, and I'll say volunteer extraordinaire.
Well,
How's that?
Thank you very much.
He's got dozens of years of experience, particularly in this area of Medicare and all the various aspects with regards to that, and is out in our community really trying to help folks to really understand Medicare and all of the Medicare changes to help us all figure it out.
Thank you very much.
Thank you so much.
Job. That's my job.
So let's start. First of all, we're coming to a point in time here that is our Medicare annual open enrollment. So tell us about that.
Absolutely. Every year, the federal government has established an open enrollment period for us, and most of us have gotten used to that, whether through a company or not, on October the 15th. So it's coming in very shortly. Very shortly it comes in. And that is the first day we can actually do enrollments. So October the 15th is our open enrollment period, and we end on December the 7th. Okay. So if you call me on December the 8th, you can take me out to lunch, but we can't do anything. So it's not like we have a long period of time. It's October the 15th, and it ends on December the 7th. And it's most important that you take a look at your plan and say, yes or no, I want to change, or I don't want to change, or at least you come to us and say, do I have to change? Why should I change? Do that, but make sure you do that between October 15th and December 7th.
And I think it's good to first, before now between now and then, what can they look at real quickly? Like what are their medical conditions? What are their prescriptions? Things like that.
They can look at that. And also by October 30th, by federal law, every plan, if you are enrolled in the plan, by federal law, they must send you the changes for their particular plan. So whatever plan you're in, you are to get. And the problem with them is they're probably written by way beyond to figure it out. But it is your responsibility to take a look and say, okay, this is my plan. Here is some material. Many people come and bring that material and say, John, what does this mean? What does this mean? Because it's usually a book pretty thick.
Or there's a lot that, several paragraphs that says it's the same. Or here's one minor change, but we can't see it through the words and the red tape.
And it does matter between what you are actually enrolled with, because during this open enrollment period, there's our Medicare and U book. If you didn't get one yet, there's the 2020 Medicare enrollment book. I was trying to figure out that lady in the blonde down there. She looks about 30, so I don't know. Wow, they're getting younger and younger. See, us seniors are getting younger, not older.
Is that it? Okay.
But if you have not received your Medicare and U book for 2020, normally they've been mailed out, or they're getting them out right now. If you didn't get one, you can gladly contact us and we will get you one so that you have it. It has a lot of material in. The best part of the material in there is the back pages. The very back pages contain the Pennsylvania Part D prescription plans. It's just the last 4 pages. You can look at them very simply. So if you're in a prescription plan, you can see what's going to be here for next year without having to, oh my gosh, where do I find this? It's in. So there is some really good material in this book. I often kid, it's a really good book to recycle, but it really does have some very good information in it.
Well, so in preparation, they should be looking for that and reviewing that a little bit with the prescription papers in the back, know what your conditions are, what your scripts are, and then certainly seek out some assistance with evaluating all of it, recognizing what the expected changes will be for 2020, and see where you fit in that, and if you need to make a change, or maybe, knock on wood, you don't need to make a change.
But you do have so many opportunities during this period of time to make changes, and it does come down to you to look and say, okay, I'm in a Medicare Advantage plan, and that is new words. No, those have been around since 2007, so we've kind of come used to the concept of a Medicare Advantage plan. You can change your plan. during the open enrollment period. You can change that Medicare Advantage plan. If it has prescription coverage with it, you take a look at your prescription coverage and make sure that the plan's going to work for you. So the Medicare Advantage plans we can look at.
So let's explain Medicare. We're all are familiar with our cards, and so we have Medicare like A and B, but
A and
then
B.
the Advantage plan. Tell me,
The difference,
what do you mean?
The,
Yes.
the very simple difference is if you have your red, white, and blue Medicare card, it has Part A and Part B. If you are in a Medicare Advantage plan, you do not use that card. You can set it aside. You don't need to carry
Okay.
it with you. You use your Medicare Advantage plan, whatever you've been enrolled in, whatever plan you have selected. Those become your primary medical coverage.
And that covers that.
That covers
similar-
everything.
Okay, very good.
That
So
covers
we
everything.
wanted to make the distinction so we understood what we were
We
talking
understand,
about.
yeah. The other people carry their red, white, and blue Medicare card. Remember, it's paper, and it is legal to laminate it. Oh, my gosh. I get 1,000 questions about that.
Okay.
It's perfectly legal. It's
Okay.
paper. If you use it and take it in and out of
Yeah.
your wallet or purse or something, it's going to get torn.
Okay.
It's very hard to get a new one. So you can use it. But if you're in traditional Medicare, you're using that, meaning you will go to
Right.
the doctor or something and you give them that card, and then you go and you need to have a Part D, a prescription plan. So during October 15th to December 7th, we can change our Part D, our prescription plan. So there we go. We can change our Medicare Advantage plans. We can change our Medicare prescription coverage. We can also change our supplemental or Medigap insurance during that period of time. So we do have some things during that time that we can change. So it's important to know October 15th to December 7th,
Are the key
but it's
periods.
also important to know, well, what can I do during that time? And those are your choices. Change your Medicare Advantage plan, change your Part D plan, change your Medigap plan. We can do that.
Okay, so let's start with, because we're going to be doing that for 2020, I know that there's some things, even just the Medicare site. Do you want to mention that before we talk about what some of the changes might be in each of those?
Yeah.
You know, the
Let
Medicare
me start
Advantage.
with some good news, because I like good news.
Okay, good.
I like good news. We are going to get a COLA, cost of living
Okay.
adjustment to our Social Security benefits. We are going to get one. They are looking at the last quarter, this past quarter's economic picture right now, but it looks like somewhere between a 1.6 or 1.8% increase. So we are going to get an increase in our Social Security,
Okay.
which they call COLA, cost of living adjustment. Of course, along with that, and I can hear everybody out there going, but yes,
Yes.
the Part B premium, remember Part A is free for about 98% of the country. The Part B has a premium attached, and the premium right now, as we sit here, is $135.50. The projected premium for 2020 is $144.30. So we did get a 1.8% increase, but we also got an increase in our premium.
Yeah.
Both Part A and Part B have a deductible. The Part A deductible, surprising enough, went down.
See, another piece of good news,
I
John.
told you I had some good news, all right? But the Part B deductible went up. Right now it's $185. It went up to $197. But those are the good
that's
things that you should know, because when you're going to make a choice and figure out what I need to do or not do, you know that those things are going to be part of your choices as you look at what you have. Remember, and I say this to people all the time, there's a big black line in between people.
Yes.
You have your
Yes.
Medicare, I have
Yes.
my Medicare. There's no such thing as, well, cover
Comparing.
me, honey, cover me.
Or compare. Well, what do you
know,
do? What do you get? Oh,
you know,
well, how come I do that? I mean, we're
yeah.
all unique and
We're
different
all
with our
yep.
needs and our.
Yeah, our prescriptions
Yeah.
can make the difference in the world. I don't take anything and you take way too, or I take way too many.
Exactly.
Yes. So remember, it is an individual choice, not like if you're coming off employer coverage where everybody was covered under one thing. This is your Medicare. So Medicare is always individual, which makes it really simple to do, because I can do yours and I can do his. It makes it easier than doing that.
All righty, so we know we can make those changes. And the site, you
Oh, the
indicated that
Medicare
the
site.
Medicare site, so if we're going to look at the Medicare, you would direct us to the Medicare.gov site
Correct.
to look at some things on there, right?
We can do that.
Okay.
For the first time since 2007, they have changed the site. It has been exactly the same for all these years, This year in 2020, they have adjusted the site. Now they've changed the site. One of the big issues when you go onto there, if you log on to
Let's clarify, it's still the same.
Medicare,
Medicare.gov.
Medicare.gov.
Would go to the same
You go to the
place,
same place.
But when we
same
open
place.
it up, it looks different.
It looks really different.
Okay.
And the first page that you're going to look on there, it's going to say, be asking you if you want to enroll in a My Medicare account. Now, I just want to point this out to people really quickly. Lots and lots of people have a Social Security
Yes,
account.
yes.
They did that because they wanted to find their benefits. Your username and password that you have for your Social Security account does not work on your My Medicare
Okay.
account. This is establishing a My Medicare account. If you want to, you do not have to establish a My Medicare account to use the site.
Okay, good.
All right, okay?
So-
Even though it says log in. Even though it says
That's where I'd stop. I don't know. Okay.
it says log in, but you don't have to log in. There's another tiny, tiny little line that says if you want to
Keep
continue,
going.
you can
Keep going. Hit
continue.
this button.
So
Okay.
please don't panic when you look
Okay.
at this and say, "Oh my gosh, I have to log in." Oh, I don't want to do that.
have to create
You don't.
an
You don't
account.
have to do that. You can actually just click on there. It'll click continue, and then you can follow the prompts on the site. And if you don't know what follow the prompts means, don't go on the site.
Well, so it's not like many of us have, they call them the My Chart accounts for your physical health it's interactive, you're able to access your medical providers to say, I need a script for this, or here are my lab results, and everybody can see them if you can see them on your chart, you can communicate. It's not
No,
such a thing.
no,
Okay.
this is not. This
Okay.
this account is specifically designed, basically, you can retrieve your prescription list without having to re-enter all your scripts every
Okay,
time. You can
okay.
retrieve them.
But we have
there,
them on
but-
paper, carrying them with us.
So I'm trying to be as
can go to the
easy as
site and
possible.
not
Go to
have
the
to
site
create
and not have to create,
an
which is
account.
the
Okay.
easiest thing in the world. I'll run it through with anybody. It's very easy to use. Once if you don't go through the creating of the account.
Okay.
It works simple, and there's a lot of things that you
And
need
I'm
to go through.
accessing the Medicare.gov just to look at,
You are going to be able to look at two things on there
Okay.
specifically. You're going to be able to look at all the Medicare Advantage plans, the ones with prescription coverage, the ones without prescription coverage. You're going to be able to look at the Part D plans, your
Okay,
prescription
prescription.
plans. You are going to
Okay.
be able to look at them. You'll be able to enter your drugs, whatever you take. You're going to
Okay.
be entering them. And there's some question that goes along with, what milligrams and how often and all that good stuff. You're also going to be able to select your pharmacy. Okay, so you are going to be able to do that. One of the interesting parts about that is the fact that you need to shop both sides of that in. You need to put in your prescriptions and shop for a prescription plan, but at the same time, and this year, believe it or not, on the new site, they allow you to look at 10 different pharmacies.
Wow.
They only allow you to select 2, but they are allowed to look at 10.
Okay.
So you can look
Okay.
at 10, and it's basically done by your zip code. So whatever zip code in Berks County you're at, the 10 closest
Just two,
pharmacies are
okay.
going to come up.
Okay.
But you can only select 2. But it's just as important to understand that you're picking your plan, because do they cover my prescriptions? What would my prescription cost? Where's the best place to get them? Pick a pharmacy. And believe it or not, there's a page there that you have to do it. You can't skip
it.
So once again, if you don't understand what the word prompts on a computer, don't do this.
well, and that's a good time to say, so if I don't have to do this either.
You don't have
This
to.
is one way to do that if I wish to do that, and I have the skills and I think I can maneuver through. Otherwise, I can call people like you.
You can
There's
call.
help out there
Yes.
for the rest of us,
You can
where I
call.
can sit down with somebody
Yeah.
and bring that information with me, and we can open up, you can look at it and assist with discussing the
Yep.
plans, and right? Okay.
Yes, the state of Pennsylvania has a program called the Apprise program. The rest of the country, it's called SHIP, SHIP. program, sometimes the senior health insurance program, sometimes the state health insurance program, but in Pennsylvania, it's called Apprised. And Apprised, we operate in Berks County. We operate out of the senior centers. You can come and see us, any of us that do this, and we'll be glad, very happy to go through the My Medicare,
And the
get you
best
to
is
this.
to make appointments.
Oh my
I
gosh,
assume.
yes.
So that would
Yes,
be,
yes,
they could
yes.
call our agency at 610-478-6500 to ask how to connect with a Price Health Insurance Counselor, or because they are working out of Berks Encore, they could call them directly at 610-374-3195 and ask to make an appointment or speak with somebody regarding this. So let's make sure that we don't really have to kind of go to that site if we're very uncomfortable doing it.
Yeah, if you're uncomfortable, do it. Call and ask, use my name. It comes up quite often.
So let's move forward
let's go.
there are some changes. In the
Yes.
time we have, we want to kind of highlight some of the changes in each of those areas. So do you want to start, you already gave us the good news about the Social Security increasing. So what about any particular things we have to be concerned about further with A and B, Medicare, the basic A and B?
No, we're
Okay.
basically following along. B, the increase in the premium was all that really happened.
Okay.
Other than that, it's fine.
We're good to go.
We're good to
We're
go
good
on
to
that.
go on that.
Very little confusion on A and B.
Okay. Do you want to talk about anything with the Medicare Advantage plan first, before like the Medigap piece, or?
Well, no, that's the Medicare Advantage plans. If you're picking into a Medicare Advantage plan, the most important part that we have to make sure of, we all became used to the word out-of-pocket money. You know, every Medicare Advantage plan has a premium. Even if it's zero, they count that as a premium.
Oh, okay.
They have co-pays. Some of them have deductibles, but all of them have out-of-pocket money. The standard out-of-pocket money, and I'll use 2019 so you can see the comparison, the standard was $3,400 to $6,700 annually. So if you created medical expenses and you shook hand with a Medicare Advantage plan, you agreed up to $6,700 to share in that cost. It's that famous statement, cost sharing in your health care. It's cost sharing. In 2020, and that's in network. That's
Okay.
another phrase we all had to get used to.
Yes.
Is my doctor's hospital lab, are they in? Are they out? Can I go? Can I not go? We got used to the concept of in-network. For 2020, the out-of-pocket money is now $3,400 to $10,000. Remember, I just told you 30 seconds ago it's $6,700
Yeah, so it went
now, and that's $10,000 in network. So
Okay.
if you create a healthy expense, which doesn't take much to do, even a not very complicated surgery, but a surgery that has some things extra than a walk-in, walk-out, you could easily spend. You could easily drop.
absolutely.
And because
Yeah.
you shook hands with that plan and agreed to it, you must know in your Medicare Advantage plans, it went to $10,000. That's the big change.
Okay.
That's the big change. Part D, and I just want to,
And-
go ahead.
Well, Part D is?
Prescription coverage. Okay. Yeah, I'm so used to acronyms. Part D is your prescription plan. Your prescription plan this year, 2020, the big news and everything else was that the donut hole was going away. And so many people got caught in the donut hole over
Yes.
all the years. On January 1st, the donut hole no longer exists. What exists is a 75-25 split for the cost of your drugs, meaning Medicare and your Part D plan, your prescription plan, will pay 75% of the cost of your drug. You and I, consumers, are responsible for 25%. Now, please don't go into a panic. Come and see us because we can
I
tell
can
you.
feel that rising. Oh, no.
We can tell you the actual cost of a drug. And I'll
Okay.
use me as a very simple example. I take eight of my prescriptions were free all year. Next year, I would have a plan that has a 75-25 split. That would not be free. I would go into wow.
Yeah.
Guess what? I can find a plan already that has many of my drugs that are free.
Okay.
They aren't stuck in the 75-25. The issue is if you pick a plan with a deductible, your initial coverage period, When you see it, it's called an ICP, initial coverage period. And the deductible for 2020 is $435. Right now it's $415, so it scooted up a little bit.
Yes, it did.
$435. After you pay that $435, that's when that 75-25 split happens. But also, when you go to the pharmacy to get a prescription, you will now pay a dispensing fee. So every time you pick
dear.
up a prescription, the fee is basically between $1 and $3 depending upon your pharmacy. So if you pay X dollar for the pharmacy for the prescription, and you're used to paying that $2, that's what I pay $2, and the pharmacy says, well, that'll be $5. That's because there is a $3 dispensing fee, and the dispensing fee is per prescription. So if you're going to get
taking a
5,
couple,
you
okay.
got 5, guess what? It's 5 times 3. It's not hard math, but it will happen. It was not here before. There was no such thing as the dispensing fee.
Right.
It is here.
And that's any
coming.
pharmacy.
Any pharmacy.
And is that automatic, or is it up to the pharmacy to decide that I will or won't put a dispensing fee on that?
Well,
Are we anticipating that
I mean-
probably they're all going to come, they're all going to say, sure, if you are, we
Yeah.
are, and
And I'm also anticipating that if everybody's $1, it's all going to be $1.
Okay.
If everybody's
Oh, okay.
$3, it's all going to be $3.
Okay.
But
Okay.
be aware that what you paid $2 for or $4 for will have this dispensing fee once you pass the initial enrollment period.
okay.
So in your initial coverage period, once you get past it. So that's a huge difference.
Let me go back to the question I thought of between that, this 25 and the 75 example, and for the prescription. Is that for whether doesn't matter if it's brand or generic?
Doesn't matter.
Okay.
It's both
Just double checking that.
75-25 split for brand names and generics. So it's,
Okay.
I mean, one of my generics I know that I get is $156 full price. That's the full price. And this year I've been getting it for $0.
Wow.
So I would be paying 25% of $156. Pretty sure I know that's not $0.
Not to mention the dispensing
Not
fee
to mention, yeah, exactly.
on top of that.
Yeah,
Oh
okay.
my, all righty. So that's some other changes in the Part D that we should be aware of?
Just the simple fact that there was quite a few plans that changed dramatically. There is no longer an Aetna prescription plan ever. They were bought out, not absorbed by. They were bought out by WellCare. And you should have received a letter. The issue with that is that WellCare is auto-enrolling you in their plan. Auto-rolling. So if it's not the right plan, if you want to look at something else, you can gladly do that. But you are being auto-enrolled in it.
So how will the folks that are in that, should they have been told by now? Because if they wish to switch during this open enrollment period, this would be the time
Yes,
to
yeah.
make that switch. Were they notified, do you know? Have letters gone out?
Letters
or-
have gone out.
Okay.
I'm not sure because I've talked to quite a few people that said they never got it letter, but I think that's a I forgot to read letter.
Or
But
it's
it
on the
is.
stack that everything
Yeah.
else should go, I don't know what it says
Yeah.
anyhow, I'll put it aside.
If you get auto-enrolled and you don't do anything, be prepared. Be prepared.
Okay.
That's
Okay.
the changes for there.
The other thing that, while we're talking about prescription coverage, I always sit here going, oh, I hope I don't have to pick. Can I just qualify for a program? So we still have the program of PACE and PACE Net, right?
We do have our
Okay.
PACE and PACE Net. The bulletin kind of looks exactly the same, except for one
Okay.
great issue. PACE and PACE Net has raised, well, PACE didn't, whoa, look at that. PACE and PACE Net didn't, or PACE did not raise the income levels. But the PACE Net side,
Okay.
which many people qualify for it,
Okay.
did. As a single person, the income is now $27,500, and for a married couple, it's $35,500. And remember, there's no assets that go with that. So it's strictly based on your income. So your
okay.
Social Security, if you're lucky enough to get a pension, if you have some interest or dividends, bingo, there you go. So if you're $35,499.99, you qualify. What does it do for you?
Yes.
That's the question everybody asks. Why would I do
Go
this?
this or- yeah.
It doesn't cost you anything. There's no fee involved in this. But if you take brand name drugs, you will never, ever pay more on the PaceNet side, more than $15 for any. So when you're looking at your
Wow.
insulins,
Yes,
your COPD
exactly.
drugs, some of those really heavy,
Costly.
you'll never pay more than $15 for a brand name drug. So it's if you've never looked at this, or if you've had a wrong attitude towards it, guess what? Clear
If
your
you're
mind.
not sure if you
clear your
qualify,
mind,
they can
and-
also talk to an
Us.
apprised counselor
Yes.
about what are the
Yep.
eligibility requirements for the PACE and PACE-Net coverage as well.
I have to tell you, I am the poster boy for the PACE and PACE-Net. I try to enroll
Yeah.
everyone I possibly can. I don't mean to be getting into your own business, but please, if you qualify under these numbers, $35,500, and you
It's a
can
good
get
program.
an insulin for 15
Yeah.
bucks,
Yeah,
get it.
certainly
Get it.
worth
Yep.
it, yep. We have a minute. The show went fast, we could be here for days, but instead, like what one quick thing other than we'll mention the open enrollment period again and how to make a connection with an apprised health insurance counselor, but what else would you like to share with us?
There are so many people that absolutely positively believe my plan works perfectly. I don't have to do anything about it.
Yep.
I don't want to go through that headache
Yep.
again. I don't want to. Please, this is my 21st year of doing Medicare. I started
Wow.
October 1st. This is my 21st year. This year, there are more changes and more things that you should look at. Do not think to yourself, my plan's perfectly and it worked.
Okay.
Please,
Just at least review.
Please review it. If you need to talk to somebody, come and see us. October the 15th to December the 7th, you can call the 478-6500 in at the Area Agency on Aging. You can call Berks Encore at 374-3195. It is extension 208 if you want to, but that's okay. As long as you get the 374-3195, you'll get to us. Please, please call and make an appointment. We're here to help you. That's all we're here to do. We're here, all of the volunteers, the two people that actually are on the staff for a prize, we're here to help you.
It's so complicated, and with all the changes that occur every year, it's something you want to stay on top of, and I know it's very hard, so seek out help. That's what I would encourage.
Yep.
Take the time, look at your information, and seek out assistance to make sure that the decisions that you're making, whether it's keeping or changing, is the right one for you.
Very good. That's what we should do.
Okay, good. Well, that is about all we have time for tonight, John. Thank you so much again. I know that you are out all over the place providing this education, and I hope that folks are able to capture some of this tonight and in our reruns. It's really important that when you get your Medicare and you book, you look at it, you look at your prescription coverage, and again, try and make comparisons, whether you go to Medicare.gov site or whether you make an appointment with an apprised health insurance counselor. So thanks so much for tuning in to Aging Matters. We'll see you next month.
Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.